So hello everyone, my name is Alexa Jean Spion, and for my presentation I will be discussing the speech and hearing effects in older adults with presbycusis. Presbycusis is an acquired hearing loss which progresses with age, which is why it is also referred to as age-related hearing loss. It is one of the most common conditions affecting older and elderly adults, and approximately 1 in 3 people in the United States between 65 and 75 years old have hearing loss. Furthermore, presbycusis is considered as the second most common condition immediately following arthritis in this population, and it is typically found to be a sensory neural hearing disorder. I also go in more in detail about the features of presbycusis, but it is characterized by an elevation of hearing levels and changes in auditory processing. So there are 4 different categories of presbycusis. First being sensory, referring to the loss of hair cells. Second being metabolic, referring to the loss of blood supply to the cochlea. Third being neural, referring to the loss of nerve fibers and neural elements. And lastly, cochlear conductive, where there is no evidence within this category. But it was found that sensory cell losses are the least important cause of hearing loss in the aged, and that the predominant form of presbycusis appears to be metabolic. There's also a connection between presbycusis and risk factors, such as age, occupational noise exposure, so individuals who work in manufacturing or construction may exhibit noise-induced hearing loss. Other risk factors include cardiovascular diseases, such as AFib or congenital heart disease. Other risk factors can be hypertension or high blood pressure, smoking, or diabetes. So now that I have introduced some background knowledge of presbycusis, I want to transition into the correlation of aging and hearing loss. So based on a review of literature that I found, it was concluded that when auditory brainstem responses are elicited with rapid stimuli, then inactivities are significantly prolonged with aging. This further suggested that slower neurotransmission played a critical role within the auditory system in older adults. I thought this was just an important chart that shows more of how aging and presbycusis intertwine, along with other factors such as cognition, depression, social isolation, and loneliness. As we all know by now, pure tone audiometry is when we ask the patient to respond to the sounds until they are unable to hear the faintest tone. For older adults with presbycusis, a loss in the perception of high tones would become apparent as a result of this test. The frequencies most affected by presbycusis are those above 2000 Hz. Since the high frequencies carry the consonant sounds, the majority of speech information is affected. So as a result of the hearing loss pattern, patients with high frequency hearing loss will often report being able to hear when someone is speaking, but not being able to understand what is being said to them. In addition, patients with presbycusis will often perform quite well in one-on-one communication in a quiet room, but the ability to hear will decline when there is even a small amount of competing noise in the background. This experience is often referred to as the cocktail party effect, which emphasizes the difficulty that patients experience with communication in social settings. To continue, speech audiometry is the test when a certain number of words are presented to the patient via headphones, and he or she will have to repeat them. So once the test is finished, the information collected helps determine if there is a deficit in speech comprehension. Speech audiometry is performed on a patient with presbycusis. The testing will reveal impaired speech comprehension. The speech of communication patterns may also appear mumbled or slurred. So in 2006, Wingfield, McCoy, Peel, Tunn, and Cox found that age and hearing loss were correlated with reduced comprehension for syntactically complex sentences. They factored into the debate on how the nature of the language materials and tasks may have affected speech comprehension. Furthermore, increases in speech rate also played an impact. So now on to treatment. There are many ways presbycusis can be treated and managed. The principal treatment for age-related hearing loss at present is with suitable amplification that provides appropriate gain at selective frequencies compression of high-level signals, and attenuation of background noise. Early diagnosis and hearing aids are main means of rehabilitation and maintaining quality of life in presbycusis patients. So hearing aids can improve hearing function for most of these cases. The use of appropriately fit hearing aids can ameliorate the withdrawal, depression, and emotional impact that are commonly associated with presbycusis and can lead to improvements in quality of life. So if this condition is left untreated, these factors may play a big part in their life. Furthermore, there is no medicine currently for treating presbycusis. And also cochlear implants can be considered for more of the severe cases. Lastly, future research for more strategies of treatment for managing presbycusis is warranted. So some takeaway points. So presbycusis is an age-related hearing loss, primarily affecting older adults between the ages of 65 and 75. There's a significant correlation of aging, hearing, and cognitive decline. And the deterioration of hearing high-frequency sounds will result in speech comprehension being affected. And as for best treatment and management, hearing aids are the most optimal. And with that being said, this concludes my presentation on the effects of speech and hearing for older adults with presbycusis. If there are any questions regarding my presentation, please feel free to ask in the comment box below. These are my references. Thank you.